Hi, I'm Abby Shank with Smith Physical Therapy and Running Academy. We're going to talk about low back pain. I know a lot of you have had low back pain at some time in your life, and to be honest, about 80% of people do. But we want to talk today about some causes and presentations and how that may affect you as a runner. So there's a lot of different components of the low back as far as the anatomy goes, and this can lead to structural dysfunction, muscular dysfunction, what we call facet dysfunction, sacroiliac joint pain, and this can also lead to pain with things like gardening, bending, stooping, getting up from a chair, bending forward, bending sideways, anything that requires everyday activities. But this can also plague us as runners and can be very annoying because we're running and all we feel is this back pain. So today we're going to kind of go over the differential diagnosis, meaning different things that can be causing back pain. We're going to talk about it in its components to running and how that affects us as runners, and some things that we can do to kind of help offset the pain. This wear and tear that we talk about that occurs over time is typically called degeneration, or also known as arthritis. Typically this is pretty normal and it happens over age and it happens over time. And there's a lot of things that can cause some wear and tear, which is pretty normal, but there are a lot of things that can increase the wear and tear. So there are things that we can do to decrease the friction or the strain or the load on the spine by using gravity to assist in things like lifting, using good posture while we're sitting at our desk, having a strong core and trunk and glutes, and good running mechanics, which we're kind of going to get into a little bit today. But we can decrease that impact and that load to the spine because we know that the spine has to absorb the shock as if we walk, and it has to withstand the pressures of your body weight. So if we think about our spine, it's in the middle. We call this the axial. And our limbs kind of hang out here, right? Our legs and our arms. And so our trunk is the foundation. It's kind of the house. It's supposed to support our body weight. It's supposed to absorb the outside shock from the ground. But as you can see, if we have any shift in our spine or we have muscular weakness, as you age, those discs and the bony vertebrae can lose fluid and height, and they can start to narrow as we shorten and shrink. And they can also cause like a little crooked spine or a little offset pelvis, and anything like that can cause more and more degeneration or arthritis, and it can accelerate the arthritis a little bit quicker and cause excessive strain and load to the spine. Let's talk about the spine itself and the structure. This is the column of bones that make up your vertebrae. Along each side is muscles that attach to help structurally support and stabilize. In the front and on the sides, you have ligaments and facets that stick out. You can also see this a little deeper with the disc height in between, which can narrow as we age. Here is the pelvic girdle with a bunch of ligaments that help stabilize the sacrum and the ilium. The facet joints, circled in black, are what connect the vertebrae in the back of the spine. They also can shift or rotate to one side when they should be moving symmetrical. When this happens, you can get a crooked spine, or you can get an area that impinges a nerve or compresses on the side of the spine itself in the vertebrae and cause pain and dysfunction. This can also limit movement and normal mobility that we need when we are running. This is the front view of the pelvic girdle. As you notice, the hip joints itself and the sockets align very closely to this. There are muscles that attach to the top of the ilium, which is also known as your iliac crest in your pelvic girdle, and there are muscles that attach on the sides, which are known as your glutes. Anything that can cause a pull, such as a strain in muscles or an offset in those facet joints that we talked about, can cause a shift in upward rotation or a downward rotation in the pelvis. You can see that there are muscles that attach from the spine and along the spine, as well as muscles that attach in the front and the sides of the pelvic girdle. Think about a mast on a ship that's being supported by ropes on either side. Either side of the spine is being supported by muscles. These muscles help you move by contracting and moving sideways, rotating, moving forward. If there's any dysfunction in those muscles, it can cause a shift in how the ship moves or how your spine moves, and this can offset the balance in the structure of your spine. So we have to make sure that those muscles are sound and they're doing their job to contract and relax how they're supposed to. As you can see, the muscle right here is called your psoas. This muscle is connected to the front of your hip and also to your spine. So if there is tightness here, it can cause you to flex forward and bringing that pelvis down and forward. It can also cause a strain in your hip as well. So this muscle is very important, but it can cause issues with a lot of runners, or especially runners who sit a lot for work and don't warm up properly. As you can also see, the muscles that attach to the spine and the pelvis can help you side bend, but if they're too tight, they can keep you in more of a side bent position and cause an altered spinal mobility and also not allow you to be upright. Anything that creates deficit in our ability to move can create deficit in our ability to run. So we want to make sure that we have good fluid mobility in those muscles and we don't end up looking like a crooked spine. As a muscle pulls on its attachment sites, it can often mimic the motion that it's creating. So if the muscle on the side is created to side bend the spine itself and it gets tight, strained, or sprained, it can also create this side bending component or make you look kind of crooked. So over time, this can become a new normal and our muscles create this memory of this being its normal position. Here is a great example what happens when we start to have muscular deficit or facet deficit, that over time it's like a sweater snag. Things start to change or structures start to change, therefore we get offset. If we already are structurally like this, it's going to also be this way when we are running. Here's an example in running where we talk about that muscle imbalance. As you can see here, the left hip is dropped, the right hip is up, and then as you look up the spine, there is a little bit of a side bend going on. So if she has pain in her back when she's running, it could be coming from this muscle and structural change that's going on when she runs, and it's giving her this postural deficit that can create pain and dysfunction along the spine. We've talked about the facet dysfunction at the joint itself, and we've also talked about a muscular dysfunction from strain. Now we're going to talk about what happens at the sacroiliac joint. So where the two black circles are where the SI ligaments are, or your SI joint is, and you have one on each side. Oftentimes where the arrows are, you see an arrow pointing up and an arrow pointing down. Sometimes the pelvis itself, those two bony side parts called your ilium, can shift up or shift down. They can shift forward and they can shift back. When doing so, those little circles that I have there can create an offset in your sacrum itself that lies underneath. So your sacrum can get a torsion, which then can strain the muscles that attach there and cause pain right at those little dimples in the back, and then can create pain while we run. Think back to the picture of the runner with the hip dropped. Over time, that dropping of the hip in a functional stance can create it structurally and cause a deficit in the muscles that surround the SI. The SI gets mad when it's not in its position it's supposed to be, and it can also create some tension when we sit, because then it's supposed to be moving when we are moving, but it oftentimes stiffens up and the joint locks, and we get more pain because we are creating this torsion every time we step with running. Lastly, let's talk about nerves. Where you see all the little yellow lines coming out are nerves that run from the spine. Inside the top part, or what we call your spinal cord, is a big nerve. And outside those little yellow lines are where the little nerve roots, or what we call our peripheral nerves, run, and they run into the limbs. So the little yellow are the nerves that run into the hip bones, the pelvis, and down into the legs. So we can get compromised from an array of different things coming from the back. If we have a facet dysfunction, if we have a torsion at our pelvis, if we have SI joint dysfunction, it can strain or cause tension on those nerves that run from the spine and down into the hips. This can create something called sciatica. The term sciatica means irritation of the sciatic nerve. The sciatic nerve is a peripheral nerve that runs from the spine and into the hips, glutes, and down into the foot. It has branches along the way, but can get irritated or it can get tight. When it gets tight, it can cause numbness, tingling, burning, and oftentimes a clinician needs to diagnose this or rule in or rule out. Sometimes a nerve can just get irritated because the pelvis itself is off of its alignment and causing tension where that blue line of the sciatic runs underneath your hip muscles. The muscle that lays over top of the sciatic nerve, which is dissected out in this picture, is your piriformis, and then your glutes lay over top of that. So if those muscles get tight or if the sacrum is off, it can cause pinching on the sciatic nerve as well. When we are taking a look at a video of a runner, we are looking from the front view and the side view. From the front view, we are looking what is happening at the pelvis. Is it level as they step and are on that stance leg? Or does it drop and they get a torsion up the spine? Some of the muscles that we look at strengthening are the gluteus medius and the quadratus lumborum to help us stay level in our pelvis when we stand on one leg. Otherwise, we end up looking crooked and we translate all that force up the spine. For stride, you see the upper body trying to twist to counterbalance the impact that travels up the chain to the back and the SI joints. A delay in the back leg or the pull leg can cause an instability and a drop in the pelvis. As you can see, there are a couple different components and variations for why people get low back pain. But a lot of those components can lead to back pain from repetition of poor use of our muscles, poor body mechanics with everyday activities, and poor biomechanics with running. There is a way to not have back pain, and there is a way to run better and decrease the strain and absorption to the low back, but it does take work. So seeing your clinician and ruling out and differential diagnosis of, is it coming from the spine, is it coming from the disc, or is it coming from the SI, or is it more of a nerve issue, is very important in order to go forward and to actually get over your low back pain.